Welcome back, everyone. We're going to continue on our HEENT series with taking a look at epistaxis and post-surgical oropharyngeal hemorrhage. It's a mouthful there. Epistaxis is the medical term for a nosebleed. Most common causes that we see within EMS are digital trauma, dryness, and hypertension. Most nosebleeds are fairly self-limiting and can be treated at home, but occasionally, sometimes additional treatment is needed. And that's partly because the nose is highly vascular, and so it can certainly seem like a lot of blood is draining from the nares and can be somewhat terrifying for some patients. The nosebleed, the extensiveness of the nosebleed will determine where the hemorrhage originates from. And we'll talk a little bit about that here in the next slide. Here we go. Anterior hemorrhages, so things that are close to the surface of the nose, bleed fairly slowly. They're self-limiting. But if there's a posterior nosebleed, that can often be more severe, and it can cause blood to drain down into the throat, and that can lead to emesis and nausea and some other complications there. At-home treatment for nosebleeds, you're just going to pinch the tip of the nose with 2 fingers. It generally takes about 15 to 20 minutes for that to clot. Have the patient sit up and slightly lean forward. You actually want the bleeding to sort of pool where you're holding the nose together and not drain into the back of the throat, because the clotting process needs those blood products there to be able to clot. In hospital treatment, so if it's need for recurrent treatment, then they may have nasal packing, which is a gauze-like material that can be inserted into the nares. That's not generally where we're at in the pre-hospital world. That's done in the physician's office setting, but certainly is an option. And then there are nasal sprays that can help with that, particularly alpha agonist nasal sprays that are vasoconstrictory in nature. As far as pre-hospital management, again, pinch the tip of the nose, have the patient sort of lean forward. Identify the need for any trauma assessment, again, so make sure that it's a isolated event, that there's not underlying causes there. One thing that often gets overlooked with especially nosebleed patients in older adults is that a patient in an acute hypertensive crisis or unmanaged hypertension, that can cause the capillaries to rupture in the nose. And so a nosebleed may be a symptom of an underlying issue. So do make sure that you assess the patient appropriately and make sure that we're not seeing a nosebleed as an underlying symptom of some other problem there. Foreign bodies are common, especially in young children. They're exploring the world, and sometimes things get stuck in noses and mouths and all sorts of places. So with a foreign body, you're going to attempt to visualize, at least take a look and see. Make sure that it's not creating an airway issue. Again, we do need to prioritize airway management. Otherwise, the foreign body, if it's not creating any airway issues or airway compromise, we'll take the patient on to a receiving facility, a physician's office, perhaps an urgent care, to have the foreign body removed. If the foreign body is left in place, that can create swelling and inflammation, obviously epistaxis and tissue necrosis. So it is an issue that needs to be addressed. Make sure that there's no life threats. Again, we're looking for airway threats, or if it's been in there for an extended period of time, there may be an infection that is as a result of that, and that can certainly complicate factors later. As far as hemorrhage management, make sure that there's no life-threatening condition that's occurring. Again, anterior nosebleeds are relatively easy managed. The big ask for you, the EMS provider, is to make sure this isn't a symptom of a larger underlying problem like a hypertensive crisis.